Nursing research, I think, is diverse and inherently interdisciplinary. Nursing research is unique in a way because it brings a very different perspective to research enterprise in general. Right now, the area I'm focused on, the research that I do really focuses on patients who are diagnosed with blood cancers and those who move on to curative treatments like stem cell transplant and cellular therapies. So there have been so many advances in this field as far as treatments, which is great, but oftentimes we don't pay attention to things such as chronic stress, frailty, cognition, sleep disturbance, which are huge risk factors and do impact how people do after their treatment. And that's my interest. I want to look at that in this particular patient population. Another interest of mine is also to understand the biology, to look at molecular markers that can help us detect these different aspects sooner. And I do work a lot directly with the patients in the clinical environment. That's where most of my work happens, but it involves going to these patients at the time of diagnosis or when they are in their treatment, asking them different types of questions through, whether it's related to stress or doing assessments for their strength and fitness. So it involves those kind of tools, but also, like I said, since I'm interested in the molecular aspect, we do collect samples from them. So whether it's blood samples or buccal swabs, with the goal to kind of understand them better. But we don't do a good job of systematically assessing them. So my goal is, if we are able to put things in place, whether it's through biological markers or assessments, but do it in a way where these things get assessed. That way, you can have interventions in place that'll improve their outcomes. They can have better survivorship, better quality of life. So that's where I see this work being impactful, really helping the clinic or whichever setting they are, in an inpatient setting or an outpatient setting, these things need to be accounted for and addressed. That's the next step, which in turn will help them thrive and do better, hopefully. That's really the impact.